So the debates were sort of a new idea to help the fellows and the members become interested in an issue that's controversial, worth debating two sides over, so that it will be very engaging for the audience, but also programs and the young and up-and-coming fellows to become involved and have a friendly competition.
So it's partly is just to have a lot of fun. You know, we want to see trainees get up there and have a good time with this, but we also want to educate the audience about some controversial topics in hepatology. We want to see how people, especially the trainees, think critically on their feet and respond to the judges' questions, which tend to be very provocative. I think it's really important for physicians to be able to think critically and to really be able to see both sides of a controversial issue, to be able to think about something they may not necessarily agree with and understand the data that's behind either side, and be able to explain that to patients so that patients can be able to make decisions about the best approach to their health care.
For the academic debates, we decided to focus on two controversial issues at the time that are very current. One looking at beta blockers and decompensated cirrhosis, and the other about transplant candidacy in patients who had abuse due to alcohol and patients cirrhosis due to non-alcoholic fatty liver disease. I think a key thing for the fellows and young doctors to speak slowly and clearly, and don't assume that they necessarily know exactly what you're talking about. You're the expert, and that you have to clearly communicate what you're trying to say without using jargon, abbreviations, or other things you may take for granted. But the key to me is to speak slowly so that the audience can comprehend and synthesize what you're saying.
I think confidence is really important as a speaker in general, but also, when you're talking to patients, knowing the data and being confident about the data is really important so that the patient has confidence in you as their physician.